Widely split first sound. Under certain conditions, a wide or abnormally split first sound can be heard. An abnormally wide split first sound can be due to either electrical or mechanical causes, which create asynchrony of the two ventricles. Some of the electrical causes may be right bundle branch block, premature ventricular beats, and ventricular tachycardia. More often, however, in actual practice, an apparently wide split will in fact be caused by another sound around the time of the first. A sound which can be mistaken for a wide split first is an ejection sound, which will be discussed later. Listen now to a widely split first sound.